Hello, my name is Dr. Michael Corey, and I'm Clinic Director here at Wellness Stop Chronic Healthcare Center in Tustin, California. Thank you very much for watching this special presentation on peripheral neuropathy. Today we're going to talk about functional neurology, we're going to talk about functional medicine, we're going to talk about peripheral neuropathy and how we can help you overcome this devastating process or degenerative disease. Now, first of all, what we want you to understand is we want to define and let you know what is peripheral neuropathy, what are its causes, and most importantly, what can be done to correct the underlying causes which made it occur in the first place so you can get rid of this stuff. Now, peripheral neuropathy, very, very common condition. Over 20 million Americans are affected on an annual basis. And we can look at it as the wiring is breaking down. The communication from your brain to the hands and the feet are breaking down. We're losing the communication. We're losing the ability for you to feel your environment. And as a result of that, your brain is actually stimulating the brain areas that are causing you to feel things that actually are not even there. So what we want to do is we want to start at the basis. We want to talk about peripheral. Peripheral means out here, away from the body. Distal from the body. Neuro means nerves. So distal from the body, the nerves, and pathy means abnormality. So we have an abnormality of the peripheral nerves, the nerves farthest away from the spinal cord and away from the brain. Now, we have 10 signs of peripheral neuropathy that I want to cover with you today. We've got numbness, we've got a burning sensation, we've got cramping of muscles, we've got sharp electric pains, we've got pain when walking, difficulty sleeping from leg discomfort. Many of you are probably experiencing that, or you've been diagnosed possibly with restless leg syndrome. Very, very common condition that also affects these same nerves. We've got prickling and tingling sensation. We've got loss of balance, or maybe you've even fallen down because you couldn't feel the floor underneath you. You couldn't get your stability, your equilibrium back in that center point. I want to talk to you a little bit more about that as we go on. Weakness and also swelling. So if our peripheral nerves are not working, we can have a variety of different symptoms present themselves in these cases. The symptoms depend on which type of nerves are affected. And we have the sensation nerves, or the sensory nerves, that's going to carry the sensation. So if wind blows on your skin, you should be able to feel that. If a dog or a cat brushes up against your leg, you should be able to feel that. When you put your foot down on the floor, you should be able to feel that, so that your brain can pick up information and help you keep your balance and have normal function again. Remember, this is functional neurology. It's about function. We don't even care about the symptoms. We want to make sure we get to the core cause of what's causing the functional problem. And then we have the motor nerves that carry signals to the muscles which help you move your limbs into each position. Very, very coordinated with brain function and eye movements. We'll talk to you more about that as we go on. And then we have the information that's carried to blood vessels, the autonomic nervous system. Your ability to breathe, your ability for your heart to beat, all those things that you take for granted on a second-by-second basis. Your brain and your nervous system is calculating, sending signals, receiving signals. We need to make sure that the nerves are functioning, that we have the autonomic nervous system working, we have the peripheral nervous system working, we have the motor aspect of your nervous system working properly. Now, sensation changes. Damage to sensory fibers result in changes in sensation. Burning sensations, nerve pain, tingling, numbness, and the inability to determine joint position sense or know where a joint is in any time and place. I'll have you do some tests when we do the examination with you to find out more about that. But we need to find out what's causing the balance problems. For many neuropathies, sensation changes often begin in the feet and they progress upward. So sometimes the feet are just the first point that's being affected to a point that you're actually aware of. And that might be what's bringing you into office this week when you make your appointment. But what we want to do is we want to get to the basis of what is actually causing your condition, because there is a variety of causes. We have movement difficulties. Damage to the motor fibers interferes with muscle control and causes weakness or loss of muscle bulk and loss of dexterity. Once again, joint position sense. How is your body moving in time and space? Cramps are also a sign of motor nerve involvement. So if we're pinching on that nerve that goes through the spine and we're compressing that, it's not going to get information in, it's not going to get information out to control those muscles and those tissues. Now, all chronic health conditions have some common things that go in stride with them. We have peripheral neuropathy, thyroid conditions, insulin resistance, diabetes, fibromyalgia, vertigo, chronic fatigue syndrome, stenosis, which is compression of the spinal cord within that spinal canal or out the nerve roots. Your irritable bowel syndrome, insomnia, migraine, and chronic headaches. So what all those conditions have in common is that they have a metabolic imbalance. Anemia can affect them. Chronic inflammation can affect them. Unstoppable and unstable blood pressure, it just keeps going up and going down. Adrenal gland dysfunction, hormone imbalance, autoimmune attacks. I'll talk to you about that as we get into the testing portion of what we do with our patients. Hidden infections. We do something called field control therapy, which can help uncover these hidden infections that maybe your doctor is not even aware of that you even have. Food sensitivities. We've got medication side effects. Hey, if you're taking statins, you're just causing more and more problem to those nerves. It's been well documented. The research shows statin drugs do cause peripheral neuropathy. So if you're on those, you need to talk to your doctor and get off of them. I will never take you off of the medications you're on. I'm not a medical doctor. I've got 19 years of practice as a chiropractor. 15 years of that I've been doing alternative or integrative medicine. And I am certified in integrative medicine also. So we have all these effects that are causing these problems. Your doctor is giving you medications for pain and for inflammation. We need to get you off of those, but your doctor has to do that. We're going to help you with the process, but I want to be very, very clear. We're not going to take you off of your medications. Your doctor has to do that for you, or you have to have a conversation with them regarding that. We've got other problems, neurological imbalances, which is a decreased frequency of firing of the cortex. If your brain's working at a lower level on one side, not on the other, your parietal lobe, which is what picks up and perceives that information to give you sensory input, called the somatosensory cortex, we're going to have problems with what your perception of feeling is in the right or the left side. And then we've got fatigue and burnout. What we mean by this is that if you have a decreased frequency of firing, those muscles are going to fatigue very, very fastly. You're not going to be able to keep up with the other side, and as a result, those muscles will atrophy, they'll get weakened, and over time, the process gets worse and worse and worse. So let's get on with the point of all chronic illnesses are a combination of neurological and metabolic problems requiring proper neurological treatment and proper metabolic treatment. So 60% of your issues regarding peripheral neuropathy have to be looked at as neurological. 40% of them are metabolic, meaning the fuel supply, getting to your brain, getting to your tissues, getting to the muscles, tissues, and organs that are dictated by energy. So your metabolism works like this. You eat your food and you get energy. Okay? Very, very basic. We have to look at what we're putting in our mouth as far as what are we trying to build energy from. We all know that if you put bad gas in your gas tank, you're not going to make it too far or too many miles away from your home. So 30% of our energy goes to what system? Little quiz here for you. Endocrine system, digestive system, nervous system, immune system, cardiovascular system. Do you give up yet? Are you having something in your mind? Pick one, pick one. What do you think it is? Okay, the nervous system, that's right. Your brain, the spinal cord, and all the nerves that conduct all the information from your brain out to the body, to the peripheral nerves, and to every muscle, cell, and tissue of your body. It's the nervous system. We need proper metabolism or energy, and for a well-functioning brain and nerves, we also need metabolic aspects taken care of, the fuel and the activation. So we want to make sure that we are providing your body with the substrates or the foundational ingredients of what give nerves the ability to function properly. The leading causes of peripheral neuropathy: statin drugs. I just talked to you about that. We have cholesterol-lowering drugs. There's not a patient that's been in my office that has been on statin-lowering drugs that has actually overcome and corrected the peripheral neuropathy. So that is something that we are going to have a discussion of when you come in the office, is are you on statins and are you currently still taking them? Damage, you might have damaged your back in years or decades ago, leading to scar tissue of arthritis, stenosis, or bulging discs. Hey, when those discs get injured and they're pushed out into the nerve or into the spinal canal, there is a big, big problem there. We need to make sure that we keep you aligned. We need to make sure that those holes are actually open enough that they're not going to be touching the nerves. But I want you to understand that this long-term damage that you might have had 10, 15, 20 years ago can be at the root cause of why you're experiencing the symptoms today of peripheral neuropathy. Diabetes type or insulin resistance. We have type 1 and type 2. Type 2 is your lifestyle. If we can back up the clock on your insulin resistance, we can make a big change with you. But I want you to understand, type 2 diabetes and insulin resistance, that is your lifestyle. We need to get to the ground root, make sure we correct those underlying causes and get you corrected, not only from a blood sugar standpoint, but also how is your body using the fuel that you're building within your body from the fuel supply you're taking from your diet and from your nutrition, your exercise. Then we have chronic inflammation. This is a biggie. A huge aspect to peripheral neuropathy is managing the inflammation. We need to correct the underlying causes of the inflammation. We need to get the inflammation to subside, to decrease, in order to get you well. Now, inflammation can be caused by food sensitivities, inflammatory foods, hidden infections, poor omega-3 to omega-6 ratios of essential fatty acids, high insulin levels, hormone imbalances, and chemotherapy can affect and cause the problems of peripheral neuropathy. Statins inhibit the formation of cholesterol. Cholesterol makes up the sheath of the nerve. Okay? So cholesterol makes up the sheath of the nerve. It's called the myelin sheath. And statin drugs also inhibit the formation of CoQ10 enzymes. CoQ10 enzymes are necessary for nerves to function properly. Now, statin drugs, as I mentioned, are the leading cause of peripheral neuropathy. So I said it once, I've said it again. I want you to understand that your statin drugs are going to be a big factor if you've been taking those. If you haven't been on statin drugs and you've got peripheral neuropathy, it's going to fall into some of these other categories, which we need to do some investigation with. We need to get to the root cause of why you're having the peripheral neuropathy symptoms. But an examination can take care of that. We'll find out exactly why you're having the problem. Now, statin drugs also increase the risk of peripheral neuropathy. A study from the Neurology Journal, May 2002, says that statin cholesterol drugs increase risk of peripheral neuropathy by 16 times. A 1,600% increase when you take the statin drugs. Enough said. Okay, let's move on. Is cholesterol really is cholesterol really the enemy as far as why they put you on statins in the first place? Well, why has heart disease not gone up dramatically since statin drugs came on the market? That's right. Why has heart disease gone actually up since statins came on the market? Why do countries with chronically high cholesterol have lower heart disease? Could it be that cholesterol isn't actually the problem? We're trying to mask the symptoms again with this cholesterol. Why do just as many people with low cholesterol die from heart attacks as people with high cholesterol? Because cholesterol is not the problem. Your lifestyle is the problem. The fuel and activation is the problem. The inflammation is the problem. So the take-home message for this is cholesterol will never clog your arteries unless you are inflamed. Okay, you have to have inflammation for the cholesterol to actually bind up into those arteries so that they can actually clog up, because they're just trying to patch up the problem. You get inflammation, cholesterol is there to do a patch job. Your brain also needs cholesterol, so we don't want to decrease it with statin drugs and do it in that avenue. You need cholesterol from proper nerve and brain function. So cholesterol is not our enemy. What we want to do is we want to make sure that we get to the core cause and the root cause of why we're having the problem. Damaged low back problems can also contribute to peripheral neuropathy. Stenosis, as I mentioned, is a canal is compressed. If we have degeneration and we have wear and tear in there, we're going to compress that. Degeneration of the disc and of the nerves, if that's the nerves coming out of the spine and we're compressing it at the nerve, then we're going to have a problem there also. Once again, structural changes can cause peripheral neuropathy. But the common trait of low back pain, your lower spine is compressed, placing pressure on the nerves that go to your feet. So as you look in here, this is a lower back. As we look into the low back, what we're going to see is those nerves drop down all the way down to the feet, and when we compress those nerves, then we can have the symptoms of peripheral neuropathy occur. A proper evaluation is very important, not just slap you with pain medications and muscle relaxers and hoping that it goes away, or saying there's nothing that we can do, because there's plenty that we can do. In our office, we utilize spinal decompression, also known as non-surgical spinal decompression. Spinal decompression is one of the many weapons in our PN program arsenal. And when we look at other things such as diabetes and insulin resistance, those nerves need a lot of energy to survive. Glucose is a nerve source of energy, and insulin is a hormone that puts glucose into the nerves. So when you're diabetic or you're insulin resistant, glucose can't adequately get in the nerve, and the nerves get fatigued. They tire out. So what we want to do is we want to take care of chronic inflammation. You see how this is all kind of building? Inflammation means to ignite, and you can't build a house if it's on fire. We've got that foundation there, and we've got the house there. Your body is a temple that your spirit lives in, ladies and gentlemen, and what we want to do is we want to make sure we take care of the temple. We've got to take care of the house, the foundation. So, common causes of inflammation that contribute to the peripheral nerves not working or peripheral neuropathy are the food sensitivities, inflammatory foods, which I recommend for us to replace with a paleo type of diet. Hidden gut infections are a common cause of what we need to correct with you. Poor omega-3 to omega-6 fatty acids, and that ratio is very, very important. High insulin levels and hormone imbalances. So we need to cause an effect as far as decreasing inflammation so that we can get rid of these triggers. Metabolic causes need to be addressed if you are going to win the battle against peripheral neuropathy. And we're going to start that off in our office as far as having a comprehensive blood work done. Comprehensive means that it's all intelligent. We're not going to give you a Chem 7, we're going to give you a Chem 26. We're going to go through and we're going to make sure that we leave no stone unturned to make sure that we can identify the causes of inflammation, the causes of inflammatory conditions that you're experiencing. Now, have you been told that your lab tests are normal, but you still have the symptoms? Well, lab ranges are very, very inaccurate. They're shaped off of a bell-shaped curve, which incorporates all of the people that have had their labs done in the past year at that lab. So who goes and gets their lab test done? That's right, sick people. Sick people get their lab test done on a regular basis, so you're being compared to that sick population of that lab that's been doing testing for the past year, and that's where the averages come from. It's shaped off of a bell-shaped curve. We'll remember all that from school as we go through. Functional lab values are more sensitive and reveal the problem. So we're going to use functional lab values. What I mean by this is why your lab tests are normal, but you still feel sick. We've got abnormally low values over here, and we've got abnormally high values over here. In these areas, you will find lab problems that appear normal. Now, your lab that your doctor gives you is going to give you a low, and it's going to give you a high. Then we're going to look at functional lab values that we evaluate you from, which are in the center here. So you can be out of this lab range here, and we got an abnormally low test. But what we want to look at is that functional lab value. Let me give you some specific examples. Your glucose level, functional range is 85 to 100. Okay, your traditional high and low ranges of labs are 65 to 110. So in this situation, you can come back and have a 73 blood glucose level, and you'd be interpreting that as, with your traditional values, as being hypoglycemic. Okay, so we would have hypoglycemia with those traditional lab values. Now, when we look at the functional range, you can clearly see that that 73 is outside of the 85 to 100, where the 73 is within the normal range for your medical doctor when they're evaluating you with these traditional lab ranges. Let's go on to TSH. TSH, your doctor is going to evaluate you from 0.3 to 5.7. With 0.3 to 5.7, you come back with a 4.2. Now, with a 4.2, you're within that normal range with your doctor, but the functional range is 1.8 to 3. So we're taking that 0.3 to 5.7 and we're bringing it into 1.8 to 3. So anything outside of that, you're going to actually be functionally high or functionally low. And this goes on with your cholesterol levels, your triglycerides, hemoglobin, and every other aspect of your blood test. So we have to use functional values so we can evaluate you from a health perspective, not from a disease perspective, and providing you with just symptom care. We want to get to the root cause. So when you can't feel your feet, what happens to your brain? Okay, if you can't feel your feet, then your brain's not being stimulated, and there is no feedback mechanism to give you that sensory input. Now, this is a research study that shows that when you cut a nerve, you get the changes in the brain. Now, we can have, as far as the changes that we see, we can create loss of balance, we can have memory loss, we can have depression, we can have anxiety, We can have Alzheimer's, dementia, insomnia. When the brain changes, your life changes. And we want to make sure that we help preserve what is happening in your nervous system, in your brain, your spinal cord, and out those nerves and tissues so that we can get you back and make sure that we're correcting the underlying causes of the problem. Now, what we see here is we see a somatotopic map of the cerebellum. And in the cerebellum, we're going to see that we've got the intra-abdominal area, your throat, your tongue, your teeth, your gums, your lower lip. You've got two sides of this, so there's one on each side here, left and right brain. And then we have the upper lip, we've got the nose, we've got the eyes, we've got the forearm, we've got the trunk, we've got the neck, we've got the legs, and then we've got the foot, toes, and so forth. So there's specific patterns of function in the brain that have to be taken into consideration. So from a communication standpoint, the brain is the master controller of everything that you are as a human being. And cellular communication and toxicity issues must also be addressed when we're looking at peripheral neuropathy. In our office, we utilize field control therapy. And field control therapy is a system that takes the shortfalls of medicine and offers an alternative path based on tenets of accepted scientific practice and research and not based on the flawed medical model. Now, FCT shines in identifying the key toxins and the underlying causes, and then it treats those causative problems with causative homeopathy to restore healthy cellular function. Ladies and gentlemen, this is a game changer. We're not looking at just symptom care anymore. We're looking at the underlying causes of why you're having the problems. And field control therapy is a powerful tool that we have that nobody else is using in helping our patients to overcome peripheral neuropathy and the problems associated with it. So what else does a nerve or a neuron need to revive and repair? Well, we talked about it a little while ago. We need fuel and we need activation. Fuel comes in the source of glucose. Remember that blood glucose, 85 to 99, and then proper oxygen. We need no inflammation and we need good neurotransmitter function. And above all, we need lots and lots of activation. So let's talk about activation. In our office, we're one of the first clinics in California to utilize brain-based neurological stimulation to activate the nerves. We're using functional neurology, once again, to fire the brain so the brain in turn can interpret the information and send signals back down the right pathways. In our office with activation, we also use infrared light therapy, we use laser therapy, we use a rebuilder system, and we use kinetic activity. So what else do we use for nerve activation repair? Well, we use a class 4 low-level laser therapy, also known as cold laser. And cold laser is very, very important because it helps repair the peripheral nerves. It's a specific wavelength of light, longer than 800 nanometers, and this has been proven to go to the nerves and cells and stimulate the energy production inside the neuron, allowing it to heal. Super, super important. You're not going to feel heat. It's cold laser therapy. It's painless. This light also stimulates the microcirculation and the lymphatic drainage issues in the lower extremities. So super important part of our process. This light has to be coherent, meaning it doesn't scatter when it hits tissues. So it's like a laser beam. We want to make sure that we get to the tissue. Now, anodyne therapy is not a coherent light and is not nearly as effective as a class 4 laser. So we use a class 4 laser in our office. We do not use anodyne therapy for this process and for these goals. So what else is done for nerve activation repair? Like I mentioned, we use infrared light therapy. We use a class 4 low-level laser therapy. We use the vibration with oxygen therapy. Hey, ladies and gentlemen, if you're not exercising, if your body is not moving, then you're not processing oxygen to all your muscle cells and tissues. So we do use the oxygen and exercise combined. We also use vibration to stimulate the large diameter nerves in the feet while providing oxygen to you. Okay? Activation. So we need to activate your nervous system, make sure things are working good. We also use at-home rebuilder system. We hook you up, we set you up, we teach you how to use this, but this will provide you with out-of-office stimulation so that we can make the most out of your treatment time and get you back on your feet and get the situation to turn around as quickly as possible. We're going to get you as well as your body will allow us to get you. We're going to leave no stone unturned to make sure that we can help get you well. Rebuilder therapy. We're going to have you be doing that daily at home to help reestablish the connections between the peripheral nerve and the central nervous system. This is yours to keep, and after the conclusion of our treatment program in the clinic, we'll have you periodically continue to use the Rebuilder system. Remember, this has been a process that's taken time for you to adapt, time for the dysfunction to occur, and time for you to feel the effects of that dysfunction. So we are going to make sure that we cover all bases and make sure that you get the activation, the fuel to overcome the chronic condition, and we want to make sure that we take care of the rest of the issues that are also a big part of peripheral neuropathy. Now the rest of the program also includes, we're going to use some essential fatty acid cream to be used in the clinic and also at home. Essential fatty acid strongly reduces local inflammation. Other supplements will also be given based on your blood test once we get the blood test back. We'll go over that. We'll talk to you about nutrients that are very essential as far as in your condition, in your situation, to get you well again. Key points. It takes many different things to correct peripheral neuropathy. Not just one thing will do it. You also must address both the underlying metabolic and the neurological problems to have success with our program. The condition is progressive if you don't do anything about it. And our peripheral neuropathy program is one of the most comprehensive and state-of-the-art that exists throughout the United States. Okay? Like I said, we're not here to fool around. We're here to get to the underlying causes of your problems so that we can get you well. Now, I'm going to give you a summary of our program. We're going to provide you with a comprehensive blood work, looking at functional ranges to identify underlying metabolic conditions causing peripheral neuropathy, including your blood glucose, your cholesterol levels. We want to see how your thyroid metabolism is. Hey, your thyroid goes to every muscle, cell, and tissue. It regulates your metabolism. Kind of important, which your doctor probably may or may not have actually even evaluated with you. We're going to use FCT or field control therapy. We're going to provide you with an examination, and we're going to provide causative homeopathic therapy and treatment for you with those conditions that are observed during the examination. So if there's a cause, we're going to attack it. We're going to make sure we correct the underlying causes. We're going to be placed on an anti-inflammatory diet to allow healing to occur, peripheral neuropathy healing and nerve activation via spinal decompression to take the pressure off the nerves. We're going to use infrared light therapy. We're going to use a class 4 low-level laser. We're going to use vibrational therapy, and we're going to provide you with exercise and oxygen. And we're going to provide you with essential fatty acid cream and supplementation as needed, directed by your blood test and the FCT examination. So we got a whole big ball of wax, and like I said, this is not an easy condition to overcome, and we're going to do 100% of our capability in helping you to uncover your peripheral neuropathy symptoms. So the question I have for you next is, we're going to provide you with the initial examination, which completes the FCT and neurological exam, including the what we call the Peripheral Neuropathy Toronto Scoring Index. If your doctors have not used the Toronto Scoring Index with you, they have not evaluated your peripheral neuropathy. It's a gold standard in healthcare to use this index to find out how much you feel in your hands and in your feet. Now, a normal score is 74, and we want to know, what is your score? What are you feeling and what are you not feeling in your hands and your feet, which are concerning you right now regarding peripheral neuropathy? Okay? Do you know your score? We have to do that examination to get to the core cause. So what's next? Well, it's up to you at this point. I want you to make an appointment if you are 100% committed towards getting well. Okay? The first 2 visits, we're going to give you a recap of what that entails. Visit 1, you're going to get a complete neurological evaluation. We're going to do an FCT examination with you as well. We'll review the existing labs, and I want you to bring those in with you. If you haven't had those done, you can call the office. We'll get your requisition form. We can have those labs done for you, and then you can come in and we'll sit down and talk to you about them. We want you to fill out the metabolic assessment form, which we'll send to you once we get an appointment made. Must be with spouse or significant other if applicable. Now this is super important because you or your loved one are living with us on a day-to-day basis, and I want you and your loved one to help each other through this as you go through the care program. Okay, it's going to be adaptive. You're going to need to follow through. Fuel and activation. This has to do with some of the foods that you're eating, and your spouse or loved one has to be on board. Okay, how bad do you want to get better? Visit 2. This is a case review if I do accept your case. Overview of further complete testing that needs to be done. Okay, a review of neurological findings from your visit 1 from your examination day, review of financial obligations on your part, and you must be with a spouse or a significant other during that report of findings as well. So what else do you need during that first visit is my next slide. I want to cover all the bases. We need you to bring shorts, sweatpants, and a t-shirt. Okay, either shorts or sweatpants. I mean, it's been cold lately, so bring sweatpants, but we need to do a sensory examination with you, so we need you in shorts or sweatpants and a t-shirt. You must have all your paperwork filled out completely prior to your examination. Prior to coming in the office, we want you to have everything filled out. Must bring spouse or significant other or partner. Okay? My offer to you is we're going to provide you with an offer here because you've watched this presentation. I want to accept 5 peripheral neuropathy patients each month. These first 2 visits will normally cost $450. Okay? You make an appointment after watching this presentation. I'm going to offer you the first 3 visits for $60. Now this is unheard of, but I have a busy practice. I want to help people that are 110% committed to getting better. And you know, this is no joke. What we want to do is we want to make sure that we get people there. Now I'm not giving you a low price to just get you in the office. I want 110% committed individuals. You have to be committed towards getting well in order for me to accept you into this program. We just want to take away any obstacles that might be hindering you from having an evaluation. Commitment and insurance. We have to go through and we have to talk about this. There's 3 rules for accepting your case. You must be willing to make serious life changes. You have to take accountability and responsibility for your health. And insurance or Medicare only pays a small portion of the fee for this care. We have made our care plans so that 96% of people can afford to go through this care plan. If you can afford $200 to $300 on a month-to-month basis, you can afford our care. Okay? So we don't answer questions on the phone regarding insurance. I want you to understand that we will bill your insurance if there is a billable code that goes with that service that we provide. Okay? 6 things to talk about and to think about. Let's go from 1 to 10. How serious is your illness? Okay? Grade this as we go through. Where do you see yourself in 3 years? Okay? Are you keep doing the same thing you've been doing for the past 3 years when this came on? How does it affect your relationships? Your work, your ability to work, your ability to enjoy your life? Think of 3 things that you could do if you did not have peripheral neuropathy. Okay? Quality of life is what this is all about. We want to make sure that you get back to living the life that you deserve. On a scale from 1 through 10, how serious are you about eliminating your illness? Like I said, there's cause and effect. We need to get to the root cause of the problem. How committed are you? Ladies and gentlemen, I cannot be more concerned about your condition than what you are. I cannot be more concerned about your condition than what you are. I said that twice because it's very, very important for you to understand. I'm compassionate, I'm empathetic. I'm going to do 110% of our capabilities with the current research to get rid of this peripheral neuropathy in your life and improve your quality of life. But I cannot be more committed than you are. Okay? Due to time constraints, I can only accept those who are truly committed. If you're not truly committed to getting healthy, please do not call the office. Okay? If you're not committed toward getting better, don't call the office. We want 110% committed individuals because we have a high success rate. We want to make sure that we can maintain that. We want happy patients who can carry on and continue doing what's necessary to live a healthy and fruitful life. This ends my presentation. If you have any questions following the presentation, send them to me at askdrcorey@wellnessstop.com. ASKDRCOREY @wellnessstop.com. That's WELLNESSSTOP.com. Okay? My name is Dr. Michael Corey, Clinic Director here at Wellness Stop Chronic Healthcare Center in Tustin, California. If you have any questions and you want to call and make an appointment, our telephone number is 714-730-5833. Thank you very much.